Hey guys, so I'm actually on my way to work now, but I decided to stop at, where did I stop? Oh my god, the Habit Grill to get a salad because I'm gonna be staying extra today. So the lunch I brought, I'm not gonna eat it, and instead I'll have this for dinner at work. But yeah, I just wanted to pop on here really quick. I figured I could just do like a, maybe like a, try to vlog every day this week about clinicals, and that would be awesome. So we did see 7 patients today. I was there from 8 to 12. I did a physical today. Yay, today is one of those days where I didn't feel stupid. Like, you know what I mean? Like, it was kind of like, you guys saw the last video, I felt very discouraged, but today I felt like better, like, hey, I know something. And then I finished reading that pulmonary chapter in that medical diagnoses book that I had showed you guys. So I think I'm gonna start the cardiovascular chapter tonight. But yeah, I'm so excited. What else did we see? We had a patient go in for like a recreational form, like a license, because I guess California pays for that, like to go fishing and all that. And then we also saw, of course, like hypertension, diabetes. But yeah, today I did the physical on a stroke patient, so I was very excited and just happy that I got to do it. And I did miss one thing, which was checking the peripheral vision, but other than that, it was good. Good morning, you guys. It's Tuesday, so I'm updating you guys. I forgot to tell you guys yesterday that one of the PAs at the clinic where I do my clinicals, he gave me the PA blueprint just to kind of give me an idea, because my school's not really guiding me as to what I should be studying. But apparently there is a NP like test blueprint as well that I still need to print out, but he gave me the PA one, you know, since he's a PA. So it's pretty cool. Actually, the PAs, like, if you're interested, the PAs have to recertify, but the NP doesn't have to recertify you. You just take the test once and that's it. So, and then they only have one test, the PAs do, like one type of test, and then we have 2 NPs. You could take the AANP and the ANCC. Don't ask me the difference because I have no idea. So I'm sure later on I'll find out what it is. But yeah, he gave me the blueprint. So pretty much, I don't know if you guys can see, but it tells you what you should know, and it's based off of level 1, 2, 3. So for example, abdominal aortic aneurysm, it's level 1, so that means that you should recognize most likely diagnoses using signs, symptoms, and risk. Refer appropriately. So let's say, okay, let's do a level 2. So atrial flutter is a level 2, so that means you need to recognize signs, symptoms, risk, and or interpreting results of diagnostic studies and have knowledge of first-line treatment. Okay. And then AFib, you need to know a level 3. So that is obviously all the diagnoses, the signs and symptoms, the labs, the results, first-line treatment, manage well-known comorbid contraindications and complications. So there's 3 levels, and then there's pages and pages of stuff you should know. So yeah, I just wanted to share that with you guys really quickly because I forgot. But also, I had other stuff I needed to tell you guys. Okay, so I told you guys about the blueprint. I've also been studying at least an hour a night. Not only have I been reading that book, but I've also been listening to Picmonic or watching it. Picmonic helps me a lot. And then also I'm going to actually start focusing more also on osmosis and Khan Academy. It's KHAN and then Academy. It's a YouTube channel, free, and I've seen it before because I've used it to reinforce some information that I was learning during school. But yeah, I'm gonna actually, last night I read about pulmonic valve stenosis, so I'm gonna look up some information on that right now, just so I can refresh myself. And yep, that's what I'm gonna listen to this morning. But I gotta go to clinicals now. It is 7:05, so I better go. Hello from the drive-thru. So I just left clinicals and it was a good day today, actually. I feel better today, honestly, like so much better, because I feel like I'm not as lost. But I did another physical today. This time I was on like a patient who was young, like in his, I think he was 29. So obviously everything was normal, but we just made sure that we discussed like STDs, especially with the age group 20s and 30s. And then we had a couple, I think, hospital follow-up visits. One of them was a diabetic who had cellulitis to the foot, and he didn't even feel that anything was wrong. So I was like, okay, he's already on antibiotics, so we just advised to continue with the antibiotics. And then of course provided diabetic education, diet control, and advised him to make sure that he's looking at his feet daily since he does have neuropathy. And also, what else did we see? Filled out some forms. Oh, of course, blood pressure. We did see a patient who had like a blood pressure, I think it was over 200. So gave clonidine 0.2 milligrams at once in the clinic. And then I was looking at the guidelines in a pharmacotherapy book, and okay, so if it's over 200, you can give clonidine 0.2 milligrams, and then after that, if in 1 hour it doesn't come down, then you can give another 0.1 milligram. So I think we only had to give 0.2 milligrams, and that was it. Then we also saw another patient who had came in for hematuria, smoker. So because there was blood in the urine, that's what hematuria means. Because there was blood in the urine, we went ahead and ordered an ultrasound to rule out bladder cancer, because she's a smoker. So that's something that's very important to do. What else did we see? I don't know. After a while, it feels like it's the same thing over and over. Diabetes, hypertension, education, weight loss, you know, all that stuff. But anyways, I'm right here in the Habit again. I came yesterday, but I'm gonna get another salad. I'm trying to eat salads for lunch Monday through Friday because we need to eat 5 servings of vegetables a day. Do I do that? No. So that's why I started to get salads and eat salads for lunchtime. I'm really limiting my carbs, you guys. It's like, as you're educating these patients, you realize that you yourself is like such a horrible patient. You know what I mean? Like you're telling these patients to eat better, to do this and do that, but you're not even doing that yourself. It's funny. It's really funny. But anyways, I'm gonna go to work right now. We did see 9 patients today, and then I'm probably gonna stay extra again past 5:30. It's really hard, you guys. It sucks to stay extra, but anyways, I kind of have to do it so I can have more time. But I'm thinking I'm gonna not go to work on Thursday, since technically I'm off for clinical. So I think that's what I'm gonna do, so I could start on my soap note, because I have to write a soap note, which brings me to that. Let me see if I can find it. I want to show you guys. Okay, so we have a template. Well, my school gave me a template that I'm using for like the information I need for my patients. So it has obviously the clinic date, which session number, like which patient number it was, like was it patient number 1, blah blah, the age, the gender, the insurance, the race, any procedures we did. We have to write down all the medications, including all the drug classes, which is a pain in the butt. Social problems addressed, reason for visit, type of decision making, so the CPT code. So if it's like a moderate if it's a moderate CPT code, it's 99214. There you go. I think if it's a low, I think it's 99213. I'm not sure. That's the CPT code. And then of course we have to write down the ICD codes and a little blurb of the patient, which sucks because honestly I feel like it takes forever. Oh, also my provider told me today that she's gonna continue on half days until March. So if I keep going every day for half days, I should be done by like the second week of March. But anyways, I'm gonna order my salad and I'll see you guys probably tomorrow on Wednesday. Happy Thursday. Yesterday, you guys didn't have a clip of yesterday's clinicals because I went to clinicals and I was like parked waiting for it to be 8 o'clock to go inside when one of the managers comes out and tells me that my preceptor called in. So I just went to work after that. So that's why there was no clip for Wednesday. It is very, very important, you guys, that you really plan ahead, like your clinical hours. I think my preceptor's already called in twice, so you never know like what could happen. She actually called in the first day of clinical and then yesterday. So my advice to you is to try to get your clinical hours done in the beginning. Like try to do as many as you can as possible instead of waiting until the end of that time frame that you have to finish them, because then you just never know. They might call in, you might call in, your kids might get sick, something might happen to your car. You just don't know. So I think it's just super important that you try to get as many hours in for clinicals at the beginning of the time frame rather than waiting at the end, because you just never know. So anyways, I think that'll put me at 100 hours this week though, even with her calling in yesterday. But we will see. I will tell you guys later how my day went and then how many hours I have, okay? All right, let's go to Starbucks now. I gotta go to Starbucks. I need my coffee. So as you guys can tell, I'm out of clinical already. I left at 2 o'clock. So I did like 5.5 hours because technically we are supposed to do a lunch. So we only did like a 30-minute lunch. But we saw 12 patients today, and I think by the end of today, I think 81, 85, 90, I think I have like 95.5 hours, if I'm not mistaken. So that's pretty good, but we did see 12 patients. So technically I only was there from 8 to 2, so that means 5.5 hours that I was there. And we did see good variety of patients. Earache, which he was having recurrent ear infections, so we referred to ENT. Back pain, so we referred for an MRI since we had already done an imaging, like an x-ray. And then also there was one case where a woman keeps complaining about abdominal pain. We saw her a few weeks ago and she keeps complaining about abdominal pain, but we just can't figure it out. So anyways, we sent her to an ultrasound, and then she mentioned that she hadn't had her, like her menstrual cycle is irregular for like the last 2.5 years. So we decided to order like the hormone test, and then after that we'll refer to GYN for her women's health, because that's not normal. She's young, she's like 30 something. So yeah, she said after her last pregnancy she kind of just like was getting irregular periods. So we ordered some labs. We ordered the FSH and what is it called, the LD I think it's called, or the LT. FSH and LT, I think that's what it is. If it's not correct, I'll put the name of it right here. Prolactin, estrogen, testosterone levels. We ordered all that, and we're gonna follow up with her in 2 weeks again to see how her results are, and then we'll probably refer her to, like I said, to OBGYN, because there's something wrong. Like, we just can't figure it out. So also by then she should have the ultrasound done as well. So anyways, let me see what else we saw. I have like all my papers here. Oh yeah, there's a patient that wanted like weight loss medication, because apparently she was seeing a provider who was giving her what is it called? I wrote it down. Giving her a certain medication that she apparently couldn't afford anymore. But my preceptor was like, nope, we're not giving you that. Something with a pH something. Can't think of the name. I wrote it down. Phentermine. apparently it could cause like tachycardia and all that, and like cardiac issues. So obviously we didn't want to give that because she has a history of like high blood pressure and other comorbidities. So anyways, that was a no. But yeah, I think, I don't know, I can't think about anything else that really stands out that I wanted to share with you guys. But yeah, I think the biggest takeaway, you guys, and a few patients mentioned it today, like, be honest with your patients. Like, a lot of the patients I'm seeing with my preceptor, it's like they're really grateful for the fact that my preceptor is super honest and just like straightforward with them, and she really tries to give them as much information as possible. And of course, you know, at the end of it all, it's really like the patient, yourself, like your responsibility to do as much as you can, you know, with the knowledge and the education that your provider has given to you. So a lot of the patients today were just saying like how they were so grateful that the preceptor, you know, that was like so straightforward. So that was like my biggest takeaway for today. Be honest with your patients, be straightforward with them, give them as much education and, you know, like knowledge that you can so that they can make a change. Don't sugarcoat stuff. Don't do things just because they want you to do them. That's the biggest thing. I think you should do what is right, and as long as you're trying to help the patient, like, you're gonna be okay. Like, if you're just ignoring their concerns, then obviously they're not gonna like you. They're not gonna, you know, want you to be the provider. And I think that's one of the main things. So for today, I really wanted to mention that because I feel like if you're not trying, if you don't care for your patient, then I mean, seriously, like, who's gonna like you? Nobody. So as long as you're trying your best to give the best care possible to your patient, and they know that you're trying, that you're listening to their concerns, then you should be okay. So that makes you feel better. I should be okay. Like, once I start working as an NP, as long as I try, I'll be okay. Okay, so today's Friday. Today's the end of my 4th week of clinicals, which means that I've already completed today my 100 hours. I think I actually have 100.5 hours. So that means I only have like 80 something to go, well, like 79.5 to go. But I'm like, yay, I'm so happy about that, you guys. So that means like in 3 weeks and a day, I should be done if I continue to do half days. So happy about that. Honestly, I don't even remember what other patients we saw. I feel like, I said again, like over and over the same thing. A lot of these patients, like I saw them previously, so they're just coming back for follow-ups because of their blood pressure and stuff. But what else? I can't think, you guys. But you guys, how many patients did I see? I saw 7 patients today, and I did another physical, so that means I'm gonna be like a pro at physicals now. At first I was having like such a hard time trying to remember all the cranial nerves, how to test them and all that, but I'm getting better, so yay. And it was like full-blown physical, like HPI, surgical history, family history, all that. So it was good. But I'm so happy it's Friday. It's actually Valentine's Day today, so happy Valentine's Day. I don't know what I'm gonna do today. We'll see. But yeah, I hope that you guys enjoyed like this vlog. I know there was like so much information, but I'm so glad that I was able to vlog this week because I felt like I really was able to share a lot of information with you guys, which is good for you guys so that you guys can kind of get like an idea of how my clinicals is going and all that, and like the little things that I'm learning here and there. So that is very good. But I do hope that you guys enjoyed this vlog. Make sure that you subscribe to this channel if you're interested in any more content, and I'll see you on the next one.